Hi, everybody. This is Dr. Lee from Lee Acupuncture. Today, I have a special, wonderful guest, Dr. Lauren Rubal. Hi, Doc.
Hi there. How are you?
I'm doing well. Good to see you again.
Yes, same. I'm glad to be here. Thank you for having me.
You look beautiful as usual.
Same. Thank you so much. I actually usually have glasses and my hair's back. So this
Uh,
is once every few months.
right. So anyhow, the reason I really wanted to invite for my interview because you are so unique and so important because in this world of infertility, somebody is so qualified like you, but also still looking at the more integrative approach. I'm so anxious to learn about your specific approach. So before I start, let me introduce quickly to the audience who you are. So Dr. Rubal completed both her undergraduate and then medical studies at the University of Miami. Afterwards, she chose to move to the University of Southern California for robust training experience at the Los Angeles County Hospital in obstetrics and gynecology. So she decided to continue there for her 3-year reproductive endocrinology and then infertility fellowship. After graduation, Dr. Rubal moved to the Orange County to become a partner physician at the Kaiser Permanente, where she practiced the full scope REI for 7 years before deciding to leave to pursue her passion for integrative fertility. She has been recognized as a Southern California super doc for 3 years and top doc of Pasadena for 4 years, and has been an invited speaker at a multiple conference as well as an author of several book chapters. So she's excited to partner with her patients to achieve their fertility goals with a holistic lens and within a boutique practice. Wow.
Oh, thank you.
What a journey, Doc.
Oh, yes, it has. That's a perfect way of putting it, is that really it's been an evolution, I would say, in
Oh,
many ways. But
exciting. So can you tell us, I mean, I explained about it briefly, but can you tell us about your specific practice?
Yeah, absolutely. I mean, I think that the background really goes into what you touched upon, which is that as practicing as a traditional REI, as I tell people sometimes, I just felt a little bit like I was treating ovaries in a vacuum in some ways, and that I wasn't able to focus as much as I wanted to on the whole person, body, mind, soul. I started feeling like I was putting band-aids on issues as opposed to identifying and seeking to heal that root cause. And so because of that, that's part of the reason that inspired me to open my own practice and also to begin my fellowship in integrative medicine at the Andrew Weil Center at the University of Arizona School of Medicine. And that, as I say, has been life-changing personally, but also for my patients, because again, I think it is a unique role that I'm bridging this really the traditional, maybe Western mode of medicine with this holistic component that and the team approach, which we, again, as acupuncture, as a practitioner of traditional Chinese medicine, you play an integral part of as well. So it's been a wonderful experience to really understand and appreciate the complexity of the body and how we can improve it with lifestyle factors and other modalities, right? Again, including acupuncture. Yes,
Wow.
heal people.
What an open mind. And actually the school, Andrew Well, I mean, absolutely. In our clinic, actually, we share patients with a meditation, like a brief meditation during the acupuncture. I use his specific, like a 4-4-4 method to start.
Oh, good.
Oh,
Yeah.
everybody loves it. Everybody loves it.
He's so wise.
Yeah, amazing. So through the experience of seeing like so many patients as a conventional, like let's say full scope RDI, and then now is helping a lot of patients with the natural fertility. What have you seen the biggest struggle many patients experiencing with this infertility challenge?
Oh, well, I think infertility is a very complex grief in many ways, because you're mourning, you know, this idea of getting pregnant immediately or having these losses potentially, which a lot of people can have, but that's the mental component. I would say that in terms of the biggest change and shift that I've seen in my practice from traditional to integrative now is really focusing in on the fact that the hormone pathways are all interlinked, that cortisol, which is the stress hormone, directly impacts the fuel that is designed to help the ovaries and the eggs be released. And so there's certainly an interplay here that needs to be honed in on and, again, optimized. We really, with my patients, talk about the gut and the microbiome and the importance of this, not only for inflammation body-wide, but also for help with fertility and egg quality. And I think the reproductive microbiome is actually also an area that's emerging in our field as its importance in pregnancy and infertility and miscarriage as well. So those are things that I think that are going to be playing bigger roles as we move into the next decade in fertility.
Exactly, because we try to find, like, everybody comes down, like, why I have this problem. And then you said, like, there's a microbiome or stress-driven factors. There's so many, or God, absolutely. So I think I'm so happy sending patient to you and then get those, like, a more like integrative approach and then whole personal approach, because definitely they need some guide from someone knowledgeable like you. Appreciate it.
Oh, thank you.
So when I visited your clinic a while ago, so the specific protocol, like a FABM, like, let's say, fertility awareness-based method. And when I look at your website, even you have so many natural approach, like, to help these patients. So can you briefly explain what this fertility awareness-based method?
Yes, absolutely. So fertility awareness-based methods, or FABM, it really is, again, just treating the menstrual cycle and our ovulation as the fifth vital sign. All it is as a woman and as a couple, you know, we women are becoming more and more tuned to our body and using our body's cues to tell us about when ovulation will occur. And so when we think about ovulation, there are so many different markers that we can use, be it as simple as the calendar method and just using an app to track when our period comes, and knowing that there are a certain amount of days that we consider and we presume that that woman is releasing that egg regularly. It could be cervical mucus, which shifts and changes in response to the cyclicity of the hormones throughout the cycle. And I think that's a great method for women, for example, who don't ovulate regularly, because we know once they get the fertile mucus, within 3 days, they'll ovulate. And so it's an ability to time a cycle. If you have, for example, PCOS and you don't have the regular periods and regular ovulation per se. We use urine or blood tests to be able to determine the hormone values and then be able to deduce exactly when ovulation is going to or has occurred. And ultrasound's also very helpful. So many people are familiar with this if they're doing fertility cycles, how we can watch the follicle grow and we can figure out the chance for when ovulation will happen or when that egg will be mature within. And then finally, we can use even our temperature, because progesterone, the pregnancy hormone, causes a rise in our body's temperature, and that can be monitored either through wearable tech or the old-fashioned thermometer. So there are a lot of different practices that truly all together, I think, provide so much insight, especially when it's not so obvious, when for whatever reason you're having abnormal bleeding or your cycle's longer, or even spotting in the middle of your cycle. It really can provide a guide as to why that is happening.
Wow. That was actually my next question, because if somebody not really familiar with their own body, even you said like a fifth vital sign, I totally agree. It's still a lot of people is a mystery. So before they hop into this like ART in the natural fertility, I always said it's a free range. You just let the patient go here and there, and then sometimes they make it, sometimes not. So you already explained those, like a BBT chart or cervical mucus, and then maybe the specific blood test or urine test, I guess. Is there any, because there's so many products out there, like every day apps coming out and the watch, machines and strips, or just simply BBT chart. And some people doesn't want because it's a little bit of like an everyday thing. Do you have any your favorite? Because there's so many tools. Is any favorite tool or effective
Yeah.
tool?
Well, I would say that for me and for patients, again, our goal is to, I always tell them, my number one goal is to decrease their stress. And so that's important since we're all different. We all are able to, you know, accomplish different things in our day, even be it having to wake up at the same time every morning to do the BBT. That's very onerous for some people. Other people love it. And so I want the patient to determine a method that's going to work and not cause more stress and empower that person. So that's the first thing being said to say. But with that being said, I think, again, cervical mucus is really easy because it's just on wiping. You could be trying to track that. And if it's obvious, it's a very specific type of mucus, right? So the raw egg white, increased slipperiness and perfusion clear. And again, you're able to really time things well, and it's an easy test to do. So I think that one's a great, easy one. I would say that I am a huge fan of urinary hormone tests because they're not so invasive. They don't need the ultrasound. They don't need the blood work. You're able to do it in the comfort and privacy of your own home. And as these tests mature and improve, they're really providing so much insight. So for me personally, I'm not like, I don't have any stock in this company or no disclosures, but I do love the Mira hormone monitor. Oh. The reason why is because I'm able to have my patients, we do cycle mapping depending on the circumstances in this patient's history, but we'll look at the estrogen, we'll look at the LH, we'll look at progesterone, and we'll really be able to pinpoint, oh my goodness, here we see that there's a deficiency here. How can we correct this, or why is this happening? And so it really is a beautiful and relatively easy way for patients to get a lot of data that's useful as we're walking through it, okay? An easier one though, if you don't, I think that there's a cost component involved. And so for other patients, if it's maybe hard to have that cost of an actual device, is to get, I think it's called Premom, are these just ovulation predictor sticks. And then there's an app where you can actually take a photo and it interprets it for you, which makes it easier. So those would be maybe a few that I particularly like for my patients.
Thank you. It was a hard question.
There's a lot, yeah.
So my next question, because when patients are having these challenges in fertility, a lot of times they a little bit of advanced maternal age. So we all deal with this egg quality issues. Is there any way do you help patients with the egg quality if you're suspecting they have some egg quality issues? Any recommendation or any method you prefer or using now?
Yes, and so absolutely. So remember, the hard part is that there's no true test for egg quality. We presume it based on a woman's age, as you mentioned. And so with that being said, what I tell patients is that on top of that, though, and the chromosome damage and the cellular damage that can occur due to free radical damage, due to inflammation, again, these are things potentially in our control that we can optimize that portion of it by using antioxidants, by using anti-inflammatories, by having lifestyle changes that help minimize those issues. And so, for example, I would say, again, a great, very natural option is dietary changes. And so there are studies showing that plant-based diets are ideal for fertility. I think that for a lot of us, that's not always the most practical, but incorporation of an anti-inflammatory diet might be, right? And so really focusing in on making small enough changes, such as half your plate being vegetables and fruits, a quarter of the protein, a quarter carbohydrates, or shifting over to all organics to minimize pesticide and exposure, trying to avoid gluten, which can be very inflammatory for so many of us, okay, or red meats. And if you are going to be eating proteins, eating the kind that aren't going to have eaten endocrine disruptors that we're then going to consume. So the grass-fed, the organic, the free range, as you mentioned. So those are some natural ones. And then I would say that there's a host of supplements that also have, data behind them that might help with different components of the cell. So mitochondrial cofactors, such as CoQ10 or even NAD, might have some promise, right? Restoring the hormone balances, like, for example, making sure that the male hormones are balanced with the female hormones. And if we see a deficiency, giving DHEA potentially in the appropriate patient. These are ways that we can improve egg quality, as well as even just great antioxidants and anti-inflammatories like resveratrol would be one example, or pterostilbene, or N-acetylcysteine. Those are some other parameters that I use depending on the patient.
Oh, I love resveratrol.
Yeah.
Their neck, and then their actually inositol is one of my favorite too. I use a
Oh, I
lot
love
of
inositol too. Yeah, yeah. It's so, again, there's benefit for thyroid, for sperm, for PCOS, for other insulin resistant conditions. I think inositol is, yeah. So there's even studies showing it helps for mood and ADHD at higher
Wow.
doses. So yeah, there's
Wow.
a lot out there for yes, inositol as well. And resveratrol, interestingly enough, there's a lot of data looking at it in the animal world. So in cows and in mice, and showing that it improves egg and embryo quality in those animals. It's just, there's not as much the leap to human data, but it for eggs and embryos in particular. But yes, resveratrol is great.
Probably regulates blood sugar, because it's excellent. We use a lot for like resveratrol to manage the blood sugar, like regulation. That's what.
Yes.
So another question I have, because this is very sensitive time, like a fertility challenge, and the time is a big factor, and then a lot of people involved. It's not only your problem, it's like a family problem. So we don't want to make any mistake. But do you see any people, because there's a lot of a myth and then things involved in this fertility journey, do you see some people make a mistake during this fertility journey?
I would say that it's, I would say that the 2 points that I love to make sure that people know and hear for the fertility journey is that, number one, it's not their fault, right? I think that there's so much guilt that comes along, and that's a huge mistake, is that they look and they say, this is I caused this because of X, Y, and Z, or not doing X, Y, and Z. And at the end of the day, I think that that's not true, actually. And so, right. And so, so therefore, I think that would be the biggest mistake, I think, in just, again, in overall terms. I would also say that, you know, I've done this for a while now, and there's always hope. Okay. And I know that we've heard it all, and I know you have too, right? And that there's always these stories that, even despite, listen, we have to be realistic, and we have to listen to the evidence, and we have to walk into any decision eyes wide open. But knowledge is power. It's important that everyone understands all their options, because I think that what happens very commonly is that we're motivated so much by fear, and then we move into one approach. And I think what's important is to always remember that that you understanding what is the right route for your life, and what the decision that's best to bring you peace is invaluable as well. And then I think the final thing is that really the focus also should not just be on quantity and numbers. That's important too, but quality of the egg, quality of the sperm, quality of the environment, your body and your womb, it matters. And so that's something that should be part of the focus.
Oh, you're such a, because what I'm seeing in our patient, those feeling of guilt, shame, and then that loneliness, and you truly understand. I think that's a lot of our patients keep saying how kind you are and understanding their journey. Oh, that is such a great help, and I truly appreciate that, and that's great support for my patients. So, can you share how a patient can find you and your practice?
Oh, sure. Yes. I have a website that is my name. So that's easy. It's laurenrubalmd.com. So LaurenRubal, as in boy, md.com. It's a long one. And so that's a great way to get in touch with me and to initiate a contact so that we can sit down and connect and discuss how I can best help each person.
I guess you offering some discovery call, like a little brief introductory call?
Yes. It's usually a 15-minute call just to hear what's going on and provide some insight as to, again, how that person can start making changes and how I see the path moving forward for us and how I can help with that person. Yes, exactly.
That's lovely. And also my impression in your practice, because it's very personalized, and then there's a doctor does, and then they sit down and then go over. So I think a patient feel very comfortable and then learn about your approach, because I think that is not really available a lot of places at this time. So very hands-on. I think that was my impression.
Yeah, I think it's so, again, it's walking alongside that person. And I think that that's very important. And it really is part of my vocation as a healer, I think, right? And so that's a big part of it. Yes.
I know you are a really busy doctor, and I really appreciate your time, Doc. And there's just so many questions I'm getting from my patients. So hopefully I can have another time with you. And I truly appreciate your time. Thank you so much.
Oh, thank you for all that you do as well. It's the same thing you're telling me. I'm hearing the same compliments back from those who are really just recognizing you for your thorough care and also the love that clearly emanates as you're taking care of all our patients. So thank you.
Thank you.